Do you know what are the common signs and symptoms of having an acute stroke? Recognizing the signs of acute stroke can make a lot of difference. Don't wait until it's too late. Learn about the common symptoms now. Why this is important? Because a stroke is the cause number 5 of death and the leading cause of disability in the US. Number 2, if you treat it immediately, it is very likely that you minimize the long-term effect of the stroke and even prevent death. In other words, if you suspect that you or your loved one is having a stroke, call 911 immediately. Stroke is an emergency. Every minute counts when you are dealing with the brain. What are the most common symptoms that indicate that you might be having an acute stroke? Number 1, acute unilateral facial droop. For example, you cannot move one side of your face. Number 2, acute onset of unilateral weakness in either arm or leg. Number 3, acute onset of unilateral numbness in either arm, leg, or even face. Number 4, acute onset of any speech disturbance, any speech problem. Number 5, acute onset of vision loss. Number 6, acute onset of headaches, especially when you have maximum intensity in less than 1 minute. We call that thunderclap headache. And especially if the headache is associated with nausea and vomiting. Number 7, acute onset of dizziness, especially when combined with other neurological symptoms such as unilateral limb weakness, nausea, or vomiting, or any acute walking issues. The rule of thumb is that any acute means sudden onset of any neurological symptoms, could be a symptom of acute stroke, and you need to call 911, even if the symptoms have resolved in a few minutes. You still need to go to the ER because these are TIAs, or what we call transient ischemic attack, or what people call mini strokes, which usually occur before a full-blown stroke. Do not wait until the next morning to seek medical attention. It will be too late.